Hello, this is Dr. Do again. This video is still on alphabetic list of problems. I think move on to letter W. The only thing come to my mind is weight management. There's some other conditions, but I think I already mentioned in the previous video in different terms. Start with different letters, but the meaning the same. But the weight management, I also had it, I think, at the beginning, metabolic syndrome or the other stream of videos. But today I'm just going to wrap it up. So how to manage weight. Let me just think about this emergency situation about this overweight, obesity. I think it's not common, but it could be if this overweight really impair the functions, cannot get up, lying down, bedridden for so many years, and causing a breathing problem, of course. And also, or if this obesity, overweight with comorbidities like heart disease, develop the sudden heart attack or etc. So these are the emergency. For the isolated obesity, like I said, if you're not bedridden, the emergency is really the complications. It could happen. So anyway, if you are really, your BMI is about 35, which means obesity, severe obesity, actually the severe form of obesity, and you develop some symptoms, either subtle or severe, shortness of breath, chest pain, do not hesitate. Go see your doctor or emergency to get it checked and make sure everything is all right. So for the weight management, I think probably 3 decades now, everybody talk about this weight management. Congratulate one if you lose weight. You hear a lot of congratulations if you lose weight. That's but still, I think still it's a long journey for everyone to battle from gaining weight. So basically, just remind or a summary: the overweight obesity measured by the BMI, basal metabolic index. It's really how to calculate. I think I mentioned before. It's your weight in kilogram divided by the body surface area in square meters. So that's how to calculate your BMI. And normal is less than 25. If it's about 25, it's kind of overweight. It's about 30, then it's obesity. If it is about 35, really need to be managed sometimes aggressively by the surgery or any other medications. Really need to monitor, because when the BMI about 35, that's one of the risk factors for many complications, many comorbidities, many from the heart to the joint to the lung to the brain, everything. So if your BMI about 35, that's really dangerous actually. So monitor it. And there's another value to measure, particularly for men, the circumferences for the waist. If it is for man, female, and male are different, and also there's a regional, I think, difference. For Western world, for man, if your waist circumference is larger than 40, or 35 for female of Western country, or Asian, for example, 31 for female and 35 for male. So if your waist circumference is larger than this, you really need to consider it, because this large waist circumferences is independently from BMI to increase the risk of the complications, either heart or brain or lung or joint, anything. What that means is even though your BMI is lower than 35, but if your waist circumference is larger than the 40 for male, or 35 for female in Western world, or 35 for male, 31 for female in the Asian, these are the inches as unit, still increase the risk of complications like the heart, the brain, the joint, the lung, everything. So this is called independent risk factors on top of the BMI greater than 35. So this is about the fundamental idea, how to lose weight and what the measure. So if you basically decrease in intake, I think it's one of the major way to lose weight. Exercise can consume the energy, but on the other hand, exercise really help you to maintain, not gaining weight, but in order to lose weight, have to decrease the calorie intake. For example, if you decrease 500 kilocalories a day, that gives a week about 3,500 kilocalories a week. Then during that week, you will lose about 1 pound. So if you calculate this, probably take 1 or 2 ounces less each day of the fat or lipid or sugars. That will really help. It's not big, but still it helps, even though it's slow. So this is the fundamental concept. In terms of how to do it, if you're from BMI from 25 to 35, you can do actually vigorously to lose. Particularly if your BMI between 25 to 30, you can lose it in short time. But if your BMI greater than 35, not recommended short time lose weight, because that the abrupt change in body weight when your BMI is so huge, like greater than 35, that impose the risk. So for those patients, especially for with other comorbidities, so the losing weight need to be guided by your physician. If your BMI is greater than 35, even above 30, it's also a good idea to get advice from your physician to monitor, particularly if your BMI greater than 35. The body weight loss is really need to be under guidance from your physician, either medication or surgical, or monitor the other values, because this, if you lose too abrupt, then cause the abnormalities like heart, the lung, the imbalance of the nutrition, and also the elements, the ions. But if you lose too slow, then will not good for the health in general, to decrease complications. So this probably is the population really needs to be managed by the physicians, the professionals, to guide you to lose weight. In terms of the calorie, less intake of calories, on top of the exercise, good lifestyle, limited stress, limited smoking or alcohol or anything on top of that, even though your BMI about 25 to 30, in between 25 to 35, you can still manage either by your physician with prescription medications, and also you can manage by yourself. But if that's the case, you really need to keep your physician updated, particularly if your BMI about 30. For those population, I'm not talking that you have to be managed by your physician. If you want to use medication to manage weight, then you have to get advice from your physician. And between BMI between 25 to 30, in this range, you can manage at home. Try the lifestyle modification, decrease calorie intake, drinking fluid to replace, particularly the fluid with some other nutrients to replace the ions, vitamins. But if you notice the decrease in weight cause some symptoms, either psychological or physiological symptoms, then talk to your physician to help you. So this is about the weight management, just some idea how to manage it. But if you want to follow my previous video, or I have posted some information, details, graded in the grading scales, how to decrease the body weight by taking fluids or eating the meal in between the time. So I'm just going to stop here, and hope it helps, and thank you for watching. I will see you probably next time.